8 is the number, actually the percentage of kids in Cleveland who actually have a college degree. 1 and 3 is the number of women in Cleveland who have type 2 diabetes. 57 is actually the percent of not Cleveland, but rather the suburban area around Cleveland, number of families who live in poverty. That's my framing of the other. Historically, in a period in which our universities by and large grew up, the general orientation was when knowledge was scarce, we built walls around privileged locations by design. It was, to follow up on Malcolm's point last night, very much a design thinking problem. When knowledge was scarce, the way to attend to advancing the environment was deliberate by creating walls around the community. But when knowledge is plentiful, or at least the transportation systems are plentiful, the interesting challenge then is how to begin to break down those walls, and rather than by design being detached, isolated, and exclusionary, well, what can we do in the 21st century where bandwidth is abundant, where innovation is plentiful? How can we begin to, in a meaningful way, make our engagement with the communities around us relevant? And so for the next 5 minutes, I want to share with you that story. The key in all of this, in terms of trying to cross the chasm, is realizing that we have to find a way of raising essentially the quality and the standard of living of people around us. And the key is to get it better than at best the incremental, if not the losses, that we've been experiencing over the last period of time. And across the nation and around the world, internet bandwidth is certainly a very big piece of it, and it's the underlying engine for the innovation, I believe, over the last 25 years on our walled campuses, now very much connected one to each other, but not necessarily to the communities around us. So Case Western Reserve, 8 years ago, partnered with the city of Cleveland to create an organization called OneCommunity, whose goal was really to collaborate and to create a new infrastructure. We could not obviously tear down the walls of the university around us, but for the last 8 years, we've been building out a new platform for collaboration, innovation, education, health and wellness and the like, and that network is called OneCommunity. It's a regional nonprofit organization in which we have sought to engage directly in the other, to engage with the community around us, to actually engage in training, education for people around us, and provided so far some 10,000 households in our community with opportunities for education, training in which the university is a direct partner, many of our students directly engaging with the inner city to help actually in education. We've also created a network to support healthcare that university hospitals and that the Cleveland Clinic and the Metro Health hospitals can touch. These are urban healthcare facilities to actually allow them to connect to the communities around us. Again, leveraging the network for both chronic disease management and for wellness, and providing wireless connectivity. We've also been reasonably successful in extending the network from Cleveland to 23 counties now all around the region. And in so doing, really try to advance collaboration between providers of services in the area of education, really looking at private-public partnerships to drive innovation between this inner city school, which has enormous challenges, healthcare facilities, which are world-class, but in our own backyard, major challenges, and of course our education work. And really trying to find a way of building out, in an era of plentifulness, opportunities to collaborate and make collaboration possible. Over the last 2 years, we at Case Western Reserve University have been collaborating with a group of community partners to actually take it a step further, and that is to provide local fiber connectivity to the neighborhoods around us, and actually created the nation's first laboratory connecting some 100 homes in the University Circle area to gigabit fiber to the home, to provide for an opportunity for, again, collaboration and engagement with the community around matters, priorities that the community actually had. For those of you who have your own speed tests at home, salivate at this. This is what the inner city of Cleveland is now able to get, almost a half a gigabit per second down and 310 megabits up. Why? It's all about the applications. It's all about health and wellness, which a great research university should be able to and should attend to, public safety, energy management, STEM education. Those are priorities of the community around us. They're also priorities in which the Case Connection Zone is focused in on, working directly with healthcare providers and neighbors immediately in the neighborhood, working on type 2 diabetes activities, not only directly, but with their kids around them, helping them use the technology, on engaging and working with them on education activities, taking healthcare directly from the surgical theater in the hospitals and delivering it right into the science classrooms, interactively leveraging that and making it available from libraries, museums, and from home as well. Obviously, this is a very, very important part of extending the network out. Neighborhood safety is enormously important. Energy management is also a significant area where our research community is engaged, as well as many of our students in this kind of activity. We've also had the opportunity to help set up a series of new businesses that have been attracted to this opportunity, which is of enormous interest to all of us. And it strikes me as I think about the New Media Consortium community and the Horizon Report is that we're actually asking you to think with us not about designing education applications in which constraint is the given, but rather abundance. What can we actually do together to impact and be relevant to the community around us, creating new art forms which leverage HD, 3D, holographic, interactive, at a distance, new kinds of art forms? What can we do in science and medicine to actually create, again, 3D, HD, interactive, holographic experiences in which healthcare providers can work in one place and at home have a doctor show up in the form of a hologram to interact with you? Those are, I think, the kind of provocations that we need to be thinking about by extending the conversation well beyond the conversations of the walls of our campuses and to try to, in a meaningful way, engage with the community around us. At a national level, some of you will have perhaps heard that the initiative led by Blair Levin, who created the National Broadband Plan, is called GigU. It's an attempt to replicate and scale the activities that I've just described to you among 37 research universities in our country. And in March, the White House Office of Science and Technology will be launching US Ignite, which is to create funding streams through the NSF and elsewhere to develop those applications that are next generation. Not about constrained bandwidth, but start at gigabit bandwidth. What can we do as a community to be relevant and to be engaged? Thank you.